My inaugural lecture will describe the evolution of a clinical academic career, and that will go from the early days as a senior lecturer in clinical pharmacology, where I combined clinical work, particularly around high blood pressure, with research and teaching. It'll then describe how I became a university leader as a Deputy Pro-Vice Chancellor for Qualities, and it will also look forward to my new role as Dean of the Birmingham Medical School. The lecture will be suitable, I think, and be of interest to a range of people. Firstly, for possibly medical students who are embarking on their training in medicine and looking forward to their careers. But also, I think, early career clinical academics who are wondering how easy it is or logistically possible it is to combine research and clinical work and teaching, and perhaps with other things like having a family. I think it'll be interesting to people who are in leadership positions within the university, either as emerging leaders or as existent leaders, to see how that particular role works in combination with the other roles that we take on during our university careers. My research is important because the area I do research on is in high blood pressure. So hypertension is one of the leading risk factors for developing cardiovascular disease such as heart attack and stroke. And as smoking, for example, has gone down, it has emerged as one of the major reasons why people still die from heart attack and stroke. So the areas that I'm interested in particular are firstly how we diagnose blood pressure, because unless we get the diagnosis correct in the first place, we're not going to be treating the disease properly. Secondly, what the treatments are that we can most use, and in particular whether by using those treatments we're giving people side effects that they wouldn't have had in the first place. And this is a particular challenge for us because high blood pressure doesn't really cause any symptoms until a person gets the heart attack or stroke. I'm passionate about it really because I think it is such a major cardiovascular risk factor, and also because we can do something about it. I'm also particularly conscious of the fact that a lot of the reason the incidence is increasing is because of lifestyle changes that we, particularly in the Western world, are choosing, and reflecting on what can be done about that as a population.